Pronto, listen. Professor José Manuel Carbajo is presenting a communication entitled Biophysical Skin Effect of Voice According to Their Maturity Time.
Thank you.
Please go ahead.
Good morning again. First of all, I would like to thank the organization, for allowing us to show our work, and a special mention to the Professor Manuel, my friend and my colleague. Traditionally, a number of fundamental principles on colloids have been considered, which in our opinion have not sufficiently studied. How much does the degree of maturity influence on the final result of the colloid? Does the type of mineral water interfere to make the colloid matter? Is the number of days of application crucial from the result on the patient? To resolve this question, we aim to study different colloids with the following objectives: try to establish the ideal time of maturity, to establish the influence of the different type of water, mineral water, on the effectiveness of a colloid, and finally to determine the effectiveness based on the number of math applications. We conducted our research with the following materials: 5 types of colloids, 3 stages of maturation of each one in different time 0, immature 1, and 3 and 6 months of maturation. The colloid was daily placed in boiler for an on 35 panelists of both sexes, on average around 24 years old, and we applied a natural temperature, a room temperature, no hot temperature. It's an important thing for the final result and the conclusions. You need to remember it. And the termination was made on the day 0 before treatment, and 10 and 20 days after implementing the treatment. The hydrologically values are considered like the normal skin pattern, and each panelist acts like its own control, as its own control. We produced 5 types of colloid with the same Ventoline and selected magnesium Ventoline, and 5 types of mineral water with number to 1 to 5. The odd ones were sodium chloride water with different concentrations on dry residue, you can see on the slides. And the paired ones are sulfur water with different concentration too on dry residue, and different concentration in sulfide and bisulfide salt. The last one, water, is a sea water. It's an ocean water from Spain to the northwest of Spain, for Galicia. We chose this mineral water because of the traditional use in the skin treatment, those we assume its efficacy. We have 5 efficacy waters. And we mix the 5 types of water with magnesium bentonite in a proportion 1 to 2.4, except, logically, the water one with high salt concentration, which we have to mix in the ratio 1 to 1.6. And then we have the ideal viscosity to apply on the skin. Then, part of this colloid were matured at the same established room temperature condition for 3 and 6 months. And we made our measurement in a room temperature and in standard condition and with controlled in the temperature and the humidity, and we use the following measuring devices. An evaporimeter to enable us to determine the transepidermal water loss. A revisicometer to assess the resonant running time and consequently establish the dermal density of the skin. A cutometer to calibrate parameters like firmness, elasticity, viscoelasticity, and skin fatigue, and pH meter, and finally a laser Doppler in order to measure the blood flow of the skin. With these devices we obtain the following results. Transepidermal water loss measures are significant. You have here in the slide the three kinds of peloid. P0 peloid is immature one with 3 months of maturation, 6 months of maturation, and each one has the days of training. The day 0 before training, 10 days, and 20 days of training, treatment. And only the mature peloid, named like E, in water 5, 10 days of application was not significant in relation to the intact skin. The result indicates that the maturation state of the mat doesn't affect to the values. There is a general increase with implementation of the treatment, and this is due to, in our opinion, to the fact that it eliminates the acid mantle of skin, and consequently a small irritation is caused, with acceleration the turnover of the cells of a certain corner. In all the cases, the resonant running time goes down. This decrease means an increase in the dermal density. The decrease is an increase in the dermal density, probably due to, in our opinion, to the hydration of dermis. But we have a short communication before, after that, around the influence from the mass in the dermis and insulation. And the moderation of the mass has no influence on the result. The state of moderation of the peloid has a remarkable influence on the viscoelastic parameters on the skin. For example, the suction capacity of cutometer is inversely proportional to the skin firmness. As shown, the moderation of the peloid increases the skin firmness, and while the immature peloid decreases. As shown in the figure, the immature peloid behaves differently to the mature one. There is a considerable increase of the elasticity in P3 peloid, which after 6 months of maturation decreases. Viscoelasticity of the skin increases with the application of the MAM. That is, skin becomes less elastic and more plastic. As you can see, in this case, the degree of the maturation is not meaningful. However, it has a great influence on the strength of the skin to be suctioned 10 times. Skin fatigue. Skin fatigue decreases considerably with maturation of the peloid. The pH is not usually significant. However, we can see on the P6 peloid that there is significance when we compare the 10 and 20 days of treatment. In any case, pH is not really influenced by the maturation of the peloid. Blood flow circulation has a pathological behavior. The application of the immature peloid has practically no influence on the blood flow. I remember we applied at room temperature, no heating. P3 pylori gradually decreases the blood flow, and just the opposite. P6 pylori progressively increases the blood flow. And then we can say that the skin condition can be modified when applying pylori, and maturation affect especially the cutaneous viscoelasticity and the blood flow of the skin, naturally. There is a discrete, in our work, in our condition, influence on the type of water used, and the skin effect can be observed in 10 days. It's not necessary to continue the treatment, except logically, if you have a chronic skin disease. And as a conclusion, we can say, finally, the type of water, in our case, is the least important thing. You need to remember, we have 5 very effective water, all of them are effective. Maturation period is vital for the result, and longer application do not improve effectiveness. To finish, I would like to show this image by the dermatologists Jennifer Gordon and Joaquin Riega, the Spanish man, which appeared in the last issue in the New England Journal of Medicine, the recent American. It's a 79 years old man whose left side, you can see on the slide, of his face has been seriously damaged owing the exposure to the sun to the left window of his tract. It's a tract diagram. I remember you, the UVA radiation crossed the glasses. Evidently, this man has unilateral dermatoidosis, or photoaging in a part of his face. And just to inform you that the right cosmetic treatment on this patient, regardless of preventing the UV radiation, will be to accelerate the skin cell turnover, to promote the viscoelasticity on the skin, and improve the skin blood circulation. And these are just the effect that the mature pylori have been on the skin. Thank you for your attention.
Thank you very much, Professor José Manuel Carbajo. Now, I hope by the end of the session we have time for the assembly to put some questions, but not for now, because we don't know if we arrive at the end of complying with the schedule time. So please wait a little bit.